hospital, not just in Florida, but globally. Next slide. You can skip the next slide. So the previous slide, it was really the changes over time. It started out as Variety Children's Hospital. If you've been a part of this community for many years, you may know it as Variety Children's Hospital, then Miami Children's Hospital, and now Nicklaus Children's Hospital through the generous donation from Jack Nicklaus and his family. This is a location, so we're not just in our hospital. We have our primary hospital, freestanding children's hospital, but also outpatient location, ambulatory care centers. Some of them provide very comprehensive care. Subspecialty care is available in many of those, radiology, urgent care services, and primarily Miami-Dade, Broward, and Palm Beach. And we have also expanded to other communities. We now have partnerships in Naples, for example. Next. A little bit about, well, this is our mission and vision, and it's really about providing hope, right? Giving hope to those families and those children that have that, complex conditions, and giving them the care, the specialized care that they need. Next. These are some of our statistics. We have one of the busiest emergency rooms in the country. We have multi-specialty group. We have all of the pediatric subspecialties. We provide services and every subspecialty that you can think of for pediatrics. And these are some of our statistics, some of our numbers, volumes, admissions, outpatient services, and so forth. Next. And these are just some of our numbers in terms of our physician bench, our medical staff, our subspecialties, again, 46 I mentioned. And we have, we really are growing centers of excellence. So we have, for example, institutes. Next slide, please. We have institutes that are growing. And you can skip that one next as well. And
One
so
more.
you can stay there. Sorry. We don't have like a clicker.
We have, but we have attached the camera to
Okay,
here. We don't have a dongle. We have a dongle here, but we
No.
need it here. So
No worries, no worries. No worries.
it'll blow your mind. Yeah.
So this beautiful tower pavilion was really more than a decade, I think, in the making. It was really a vision. We had a facility that was over 70 years old. We had rooms, patient rooms that served up to 2 and 3 patients. And we really wanted to create that privacy for the family, that the experience. We have families coming from all over the world. We serve children from over 100 countries that come to seek care at Nicklaus Children's Hospital, primarily South America, Latin America, the Caribbean. And so now this pavilion allows those families to have that privacy. They're very spacious. I know we've toured the rooms, very spacious rooms, high-tech technology, obviously, to enable great quality patient care. And for those, when you come down to Miami, I'd love to, or our hospital, love to give you a tour and show you around our facilities. Next. So these are some of the institutes that I mentioned. We have cancer, brain, orthopedic, neurosurgery, neurology, and a heart institute. So these are really centers of excellence. It's comprehensive care. It's a multidisciplinary approach. It's being able to care for the sickest children. And the organization has really been focused on building these institutes. It's coming together now, actually, although we've had these services for many years and centers of excellence for many years. It's really been a strategic focus to build on those institutes, and that's ongoing. Next slide. We're also a teaching program, one of the largest in the Southeastern United States. We train many medical residents. We have, through the residency program, we've built such great alliances also. Some of our residents come from all over the world also. Latin America, they come train with us. And so we've really built some great alliances and really contributed to the body of knowledge and to the next generation of physicians. Next slide. So US News and World Report is important. And for any organization that is says that they're the best, right? They want to be ranked in US News and World Report. So we rank in these subspecialty areas and really showing that we are among the top children's hospitals in the nation and providing quality care. It's something that we really work at, the organization works at. studies and really benchmarks and analyzes, right? Every year there's an evaluation through this rating system. And it's an opportunity sometimes, right? How do we continue to elevate the bar? Next slide. Accreditations are also important, right? To show to the consumers that we are the best, we invest in time. So DMVGL, for example, is one of the accreditations that we have, that we transitioned from Joint Commission years ago, for those of you that may be more familiar with that accreditation as well. Next. Awards and accolades, so many awards and accolades. I've been fortunate to be part of the telehealth strategy and initiative since 2013, and it's been a great alignment and collaboration with IT. So IT, for example, our information technology department has been ranked and is receiving constant accolades with accomplishments, not just in telehealth, but also in our EMR, for example, deployment, using data within the EMR to embed in the care delivery, right? To use that data effectively, to have a data governance structure that is aligned to care, to use that data efficiently, to be able to continue to elevate care again. Next. You can skip that one. Next. Yeah. So telehealth, I mentioned I've been part of telehealth since 2013. It really started as a vision of our CEO to be one of the first. And although telehealth has been around for decades, and before the pandemic, it really wasn't mainstream. It wasn't understood or maybe accepted. And of course, we know what has happened since the pandemic. It's such a different scenario. But we invested in it before the pandemic. We had programs that were very successful. And at the end of the day, it's about improving access to care, that center in the middle. There's convenience, right? Meeting children where they are, where they live and play, and where they learn as well. So some of our programs were school-based services, for example, to meet children that maybe are in underserved communities that do not have access to healthcare. And we were able to secure some grants to be able to provide those services at no cost. Just to give you an example. These are some of our metrics. So we have telehealth services in about 24 specialty areas. These are some of our visits since the pandemic. This is all during the pandemic, the numbers that I'm giving you. We have over 190 providers that are participating in our telehealth program and very high satisfaction. Next. So about satisfaction, we had a Biscayne is our hospital-wide survey that we had before the pandemic. And around June of 2020, our provider or the administrator or our satisfaction survey created a telemedicine survey. We had been gathering data before the pandemic, but it was very manual. We had surveys that were either even emailed or text to patients and families. We had good data, but it was very manual. What this allowed us to do is really also compare and benchmark against other children's hospitals and also against our in-person survey, which provides really meaningful data. So in this, the last chart is the satisfaction comparable to in-person and virtual care. And then there's the overall likelihood, excuse me, to recommend, which is the overall. For every single question that is the same on the in-person survey, comparable to the virtual care scores higher. Every single one scores higher for virtual care. Even questions like the provider listens to my concerns. It's the same provider. These are the same providers. We don't have dedicated telehealth providers. And so the patient really sees and values that. The ones that have, you see the biggest gap, right? The biggest difference, it speaks about convenience, ability to schedule on a convenient day and time, which of course is, it's no surprise there. The likelihood to recommend overall is the same. And it's been like that throughout the pandemic. It's been like a 1% difference up or down in person or virtual care. And that's also not a surprise. Telehealth is not for everyone, right? They may say when we compare those questions that they evaluate more, but overall it's not for everything, right? It's not for every condition. Sometimes you want to see your doctor, and really it's a hybrid model that works in this case. Mm-hmm. The other chart that I had on that, which is a distance travel tool. So we created a distance travel tool using Google Maps, Google Analytics, and it really measures just the mileage, the miles saved. It's just one piece of the savings. Think about how much a parent can save lost wages from taking a child to a doctor's appointment that they can now be seen in their home. that's not measured here. This is only gas, right? The fuel savings, the time savings of going to our hospital. And how we measure it, we look at zip codes. We look at the patient's zip code and also our main campus zip code. Next. And then these are some of our volumes. So our over almost 50% of what we're seeing virtual care is mental health related. Behavioral health includes psychology, psychiatry, neuropsychology. The next, and I have that, you can go to the next one. I have it in the pie. So if you see the pie, the blue is behavioral health. Then the next large, the orange is subspecialty care. So all of those 20, almost 20 subspecialty areas, excluding mental health, is that other larger piece of the pie. And then we have primary care, rehabilitation services. We have dental services that fall under the lower volume categories. Next. So behavioral health, we have a very comprehensive service in the hospital, and we do not have enough beds, unfortunately, to meet the demand, the tremendous demand in our community. And by beds, I mean those are children, of course, that need psychiatric inpatient hospitalization. But we have all of the services available. We have the best psychologists and neuropsychologists and psychiatrists, a comprehensive care team. But the demand is overwhelming. And so one of the things that came out of this beautiful alignment with Rotary was that the concept of mental wellness. We go to the doctor's office for a wellness checkup once a year, but we do not have benefits in our insurance, most insurance companies, right? Unless it's like a value-based arrangement, very specific. The majority of the population doesn't have a mental wellness visit that they can get reimbursed by their carrier. And so this is where we were just right as our partnership was coming together, the pandemic started, right? And then we had these great funds, and we really thought about like how can we really test, right, and pilot something that could be really meaningful. So the idea came about doing mental wellness screenings, aligning to the medical home. The medical home is your pediatrician, the primary care physician. And so that is a great opportunity because oftentimes it's those pediatricians that are identifying the first, or they're seeing the first signs of potential mental illness. The parent may express the child is anxious or is having a significant issues with transitioning, maybe starting middle school, for example, or high school or college. And so we aligned with our primary care provider at our main campus, first of all. And then we expanded. So we've expanded to Hialeah, we've expanded to Alapata, which is where we have smaller locations with one provider. Our main campus has more providers. And so this new service was added that is included as part of our comprehensive care. Next slide. So these are some of the top complaints. So you have major depressive disorder by far being the highest one. Attention deficit disorder, how very prevalent in our community. My own child has attention deficit. It's something that many parents struggle with, and children, unfortunately, that may be very gifted and very capable, but unfortunately, struggle and that hinders their potential. Anxiety disorders, disruptive, and bipolar disorders. Next slide. These are some of the evidence. I'm not going to read all of the evidence, but you have some of the literature here, and really there's great studies, great evidence out there. We would like to publish, and I was in this meeting the last time I met with Michael Nearing, talking about our goal to publish our results and collaborate with the Rotary as well in publishing those results. Next. And then these are just some of the community needs, right? Again, we know that the demand is so great in our community. These are some of our statistics from our community needs assessment. We're about to publish our latest community needs assessment. It should be out any day now. And it says the same thing. I've seen a preview. It really just reinforces that the need is still there. It's still tremendous. Next. So these are just competencies and the thought about the importance of the medical home, the primary care physician, these reputable associations, right, that govern these providers and these disciplines speak about the importance of aligning and integrating mental health within the medical home. But unfortunately, our payer system and all those other kind of, red tape doesn't allow for these best practices to really flourish. And so what we've been able to do is, and to give you a rundown of really overview of the workflow, how it happens, right? A patient goes into their primary care physician's office, expresses a concern. The providers are trained by our mental health providers. Number one, they've been given some education so that they can see the signs, or they can try to help the family. At the end of the day, the pediatrician needs to be empowered and educated to provide that care, as well on their own. But if the child needs additional intervention, we're connecting the child within less than 7 days, or right at the moment of that visit, with a mental health provider. Less than 10% of the services that we're seeing are right at the moment of that visit. That it has been a goal of ours to see those patients at that moment for many reasons. Sometimes the stigma gets in the way, right? The parent may not really, be ready to face that there's a challenge. And once they walk out the door, out of sight, or they're just not ready. And so they may not follow up. We do have a high no-show rate ratio, and that's something we're also working on as part of this program. So about 10% right now, they're seeing there's an iPad in the PCP's office, the pediatrician's office. We can connect that family. There's a coordinator in that office that allows for that interaction to happen as quickly as possible. Next. So this is just a vision of all of the services that I mentioned earlier, that we providing comprehensive care, and then we added the mental wellness component. That mental wellness component on the right, it involves also consultations between a primary care physician and the mental health provider. Again, education and embedding and integrating those mental health providers within the medical home. So there's a peer-to-peer consultation aspect, case management also, right, through our coordination efforts. We also have a social worker on the team. So if the patient needs additional intervention, higher level of care, then they will also be connected for those services for more long-term care. Next. These are some of the roles that I mentioned in our team. On the left, these are the positions that are part of the grant. The right are many other. It takes a village. So we're supporting in the program as well. Next. These are some of the measures that we've been tracking, and we have reduction, for example, distance traveled. I showed you some of the data. We're going to track the data throughout the rest of the program. Visits, lives saved. I was going to say it is life saved, and it could be life saved, right? If we're able to provide that instant and early intervention. Next. And then these are some of the statistics. So 685 patients that were referred. We had 285 behavioral visits as of this period of time, consultations as well. And then we're tracking the access. About 68% of the time, we're able to see those children within 7 days or less. And then 9% are seen on the same day. I can tell you that the 68%, it could be 100%, but the family, of course, has the say. And if they want to schedule an appointment in a month or in 3 weeks, they're given that option. So it's really up to them as well. Thanks. These are some of the dispositions. So oftentimes the child may only receive one visit, and that's all that they need. They get tools, they get education, but we do allow up to 4 visits. And why limit the 4 visits? We want to make this sustainable, and this is actually something we're working on for their second grant, is we want to transition them to another provider or within our own system to get that higher level of care, and then it'll involve payer, insurance, and so on. Next. So these are just some conclusions. There are some statistics that show that it could take 8 to 10 years for a child to be diagnosed with a mental health condition and receive care after the first signs. It could be, and this is real. So this is again our true north, right? Is what we want to do is, if we're able to see those children at that moment when that potential issue is identified, hopefully we can remove the stigma, we can get that early access and education that is so important, so that the family understands how important it is to reduce that, right? And we don't, reduce them not by 8 years, by to be able to get that within days, within hours, within months. of that first identification. So I think that concludes.
Any
And,
questions?
If I may, I'd like to add a couple of points as well. The one point that you brought up about the stigma, do you remember years ago, if anybody had cancer, there was no conversation, people kept it under wraps. And mental wellness is in that same category. So one of the beautiful things that's occurring as we talk more and more about mental wellness, it becomes so much more important to save lives and what's going on there. The other exciting thing is that we're setting up a mental wellness committee at the district level, but many other Rotary districts as well are looking to set that up and work with their local hospitals. There's a gentleman that we ended up, and asked you to speak to him, Bob Anthony, that I have met at the Houston International Convention on mental wellness. I thought, oh, a breakout session on that. And he's working with the Boston Children's Hospital that has a program that's been started as well. So it's about, again, that partnership where we can get a lot of people together and save lives. I mean, the lives that are being saved from suicides and all these other mental wellness issues that come up. So it's an honor to know you, and the work that you're doing with your group is amazing. So thank you, thank you.
Likewise,
Yeah.
likewise. Thank you so much.
I think there might be some questions.
Oh, yeah, yeah.
I would, could you clarify, I'm trying to get the differentiation between Nicklaus Children's Hospital functions and services and what the Rotary grant is doing.
So the hospital provides evaluations, treatment for an illness. Once an illness, there's a diagnosis. And the 8 to 10 years is what I was referring to. Sometimes it takes that many years to get a diagnosis. In order for insurance to pay for services, that diagnosis has to happen. That pathology has to be identified. And so the moment that a patient has an anxiety or a concern, and if they're expressing it to the primary care provider, we're able to connect this team that is part of this project, this program, with the patient instantly. That 9% is
That's the grant money going to that. those
to that
services.
we're calling mental wellness services because there isn't a diagnosis again at that moment. And it could lead, and some of our patients were referred to a higher level of care as needed.
Thank you.
So it's a screening, so we call it, you know, I mentioned evaluation treatment, these are screenings, and that's what's typically not covered by insurance.
I have a question. Well, I have 100 questions.
Yeah.
The first one is that the spectrum of psychological disorders has expanded exponentially. So now you have that many more quote conditions that you're treating. Is there any particular area that the hospital concentrates on is more important than some of the other fringe ones? So I've just seen just an expansion of this, and it has nothing to do with the pandemic per se, but I think it has to do with just that expansion of that spectrum of all of the different conditions broken down into little pieces.
I'll just call out a few. I mean, I wouldn't say that we're specializing in any, we're really treating all, but recently our physicians, our psychologists collaborating and putting together clinical pathways for two conditions that are really of concern. And they no surprise because they were listed on our program diagnosis as well, which is depression and anxiety disorders.
Yeah.
So they've already completed the depression clinical pathway. They're working on the anxiety disorders, and we're aligning and using those tools that they're created as part of our program as well. And the other one I would mention is autism spectrum disorders as well. There's been a lot of focus there on really a comprehensive multidisciplinary approach, early detection, early intervention.
The second question is having to do with telehealth. And while it's been around for a long time, in fact, one of my clients in 1990 did this for Latin America. And it was done with doctors in a room, and they could talk to people in Latin America and look at the x-rays and everything else. And technology's increased dramatically. But for example, my wife's oncologist, we had telehealth. I don't know what good telehealth is for that kind of, because you can't really tell if the patient's not with you to help to, you know, that bridge was very difficult during the pandemic, where people basically were not able to get that care. How do you avoid, I mean, how does a doctor who's doing telehealth say, no, you need to come in, or you need to go do a blood test, or you need to have something more physical as opposed to just a discussion on the medical side, not.
Yeah, so I mentioned the hybrid approach. The hybrid model is really, it's key. It's really having, number one, consumer choice. The patient ultimately has a choice. Is this something that they value, that they want to participate in, that they see as value added for their healthcare? And then the physician has a duty. Their duty is to provide quality care, and they have to identify what's appropriate and not appropriate, right? My own mother-in-law had cancer during the pandemic, and many of our visits, we were going to the cancer center for in-person services because it's very specialized, or you're going for procedures and things like that. But there was also a few visits that were done virtually. It's really follow-up. There may be some follow-up on medication management. It's a very important use case for telehealth, right? And especially for those that are vulnerable, that they're immunocompromised, and that visit, you know, could be life or death, right, in this pandemic, right, and being exposed to COVID. So there could be a combination.
Thank you. Yeah, we looked up there to see if anybody had a question. Nobody raised their hand. Any questions from the folks online? Good. So who wants to do happy dollars this morning? I think Ines Ikeda is going to do happy dollars.